Hi, my name is Allison Schroeder, and I work as a travel nurse on a surgical unit for transgender reassignment. I am also like the med-surg tele float nurse, so I float between 20 units in this hospital as well. So I took the Optimal Healing Environment Assessment Survey, and the results were as followed. Question 1, are all patient rooms private? I said this is false. Is there adequate space provided for families to stay overnight in patient rooms? This is true. Is alcohol-based hand sanitizer dispensers located in patient rooms and common areas? I put true. For the fourth question, it asks if it talks about noise levels in hospitals, and my hospital was in like the 40 to 60 range, and so I put true because that's not causing any damage, but sometimes makes people irritated. So does the unit or organization have a noise reduction plan, eliminating audible paging, closing patient doors, etc.? I put true. There is a plan in place, but question 6 says, does noise reduction plan, has it been implemented? Is it active, and can it be readily observed in daily routines? I put false because after talking to some nurses, not everybody knows about this plan and is implementing it every day. Is lighting optimized in medication prep areas? I put true. Is unnecessary patient transfers minimized? I put true. There's education on that in orientation for every single staff member. Do bathrooms have larger doorways? I put false because not every single room does. Some are very inconveniently placed. Are optimal air filtration systems installed to protect immunosuppressed patients? I put true. Are ceiling-mounted patient lifts present in patient rooms to reduce staff injuries? I put false because they're not present in every single room. Are ceiling-mounted patient lifts present in patient care areas to reduce staff injuries? I put true because I would say that they're available on patient, care areas. Is there clear and effective wayfinding systems present throughout the unit or organization? I put true, but these systems aren't readily available to all staff members, newer staff members, travelers, they're not known. Are positive distractions like music available to assist in reducing patient anxiety? There are. Are there positive distractions like art and interactive art available to assist in reducing patient anxiety? True. Are there positive distractions like specific architectural features available to assist in reducing patient anxiety? I put true. Are patients able to exert their choices for lighting? True. Are patients able to exert their choices for privacy? True. Are patients able to exert their choices for music and visual images? I put true. We, at Kaiser Hospital, there are tons of people, volunteers, and other staff members that come around throughout the hospital, I think twice a day, to each unit twice a day. And they offer different things for patients and family members. And in all the rooms, there is, on the call button, there's lighting availability and whatnot. So, and every single room has a TV. What were the areas of best performance? So the best performance areas were in providing patients with options for reducing anxiety, privacy, and overall choices or preferences that the patient had. What opportunities for improvement based on the survey results? I think the best areas for improvement would be the clear and effective wayfinding systems. They're present, but they could use some education on how to use them, possibly a how-to for the unit, and also not all rooms are private. So I was able to share the results with my assistant manager, my manager, and this was their response to the data. So I was able to share the results with my manager on the floor today, actually, and she and he were both very pleased with the results. They acknowledged that it wasn't clear knowledge for newer staff and travelers on how to navigate the wayfinding systems, and they stated that in regards to private rooms, they stated that all of our surgical patients have priority to private rooms, and overflow patients will usually be taking those shared rooms. How is technology used to increase efficiency and safety? What is an example of this adoption that has positively impacted this in my work environment? So technology is used to increase efficiency, safety on the unit by having technology-based community options, such as chart chat for casual conversation, and you can make a group chat with the entire healthcare team for the one patient, with the one patient being the header, and then all the group members being included, and you can all chime in. So it's a really interactive way that we can all kind of work together and give in our feedback so that we can improve like quality patient care and have the best outcome for our patients. Another one is the pager system for contacting surgical teams. It's called My Airmail, and it's the how-to is actually on where you find it, so it's really easy to use. And if you just hover over the patient's face, it will show you the doctors and their preferred method of contact. So it'll say chart chat preferred or My Airmail pager system preferred. And then you can put your number and your contact, and they get back to you very quickly. I've had really great success, probably the best communication I've ever had in a hospital here. So, and these are both two really prime examples of how technology is being used to increase efficiency and safety in my work environments, because it's not hard for me to try to contact physicians, and it's also increasing safety because we're able to recognize problems faster and fix those things. So, thank you.